Excuse me, just one second. I'm
Yeah,
sorry.
that's all right.
I apologize. I can't hear you.
Life happens.
I can't hear you.
Okay, I'm gonna.
Life happens.
This
I
is
can't hear you.
this is getting very strange.
I'm gonna. Life happens.
Okay, I'm gonna turn that off. That is bizarre. Okay, so I am here with DeLeesa Meashintubby from Volunteers in Medicine, the executive director over there. I am the executive director of the Shelton McMurphy Johnson House, and we are leading a series of virtual presentations about vaccinations and their impact on our community. This goes along with our current exhibit, which is vaccinations, from pustules to MNRA. We're very excited to speak to you today about the impacts of vaccinations and people with low income. So welcome, and thank you so much for your time today.
You bet. Thank you for having me.
So why don't we start with a little bit about yourself, DeLeesa?
Well, I'm DeLeesa Meashintubby, and as you said, I'm the executive director at Volunteers in Medicine Clinic, but also I'm a pastor of St. Mark CME Church in Eugene. And the things that we've seen over the past 2 years, almost 3, is just that resilience is something about the people that we serve, the low income, as well as those who have no access to health care. That's Volunteers in Medicine's mantra here. We take those who do not have the Oregon Health Plan. They make too much for the Oregon Health Plan. Some of the people we see have insurance and they're low income, but there's no the deductibles are so high that they can't get in to be seen. So what's happened with, I would say with COVID and what COVID has done, it has opened our eyes to the fact that even though people do have maybe access, it's hard to navigate the system when you don't understand the system. And so it's helped us to be able to regroup and to be what we need to be to the community as well.
Mhm.
I would say it's allowed us to not only see patients, but we had to become a little bit humble and see them by, I guess you would say, telehealth,
Mhm.
by the phone or whatever, because a lot of our patients need that help. Diabetes, hypertension, and behavioral health, such as anxiety and such, those are our number one on any given day. Each one of those could be the number one diagnosis. And what we try to do now is to meet the patient where they're at. They can't get in here to be seen at times, but we can talk to them on the phone and such. Another thing that makes us humble is to know that not all of our patients can self-manage their diagnosis. And so it's now at the point to where we're not just taking care of the diagnosis, but we have to take care of the patient as an individual as well, because not everything happens the same for each patient.
Mhm.
So we had to change how we do medicine ourselves.
Mhm. And that causes some issues just from the standpoint of not everybody has access to that technology as well.
Exactly. Not everyone has the access to the technology. And then when people vaccinated versus unvaccinated, there was some of our doctors, as because we are a volunteer organization, some of them were hesitant about seeing patients that were unvaccinated because
Mhm.
it puts them at risk as
Right.
well. And it's not that they didn't want to see them, it's that they would be taking home to their families some of these things too. So what we did is allow those who couldn't see them face. Resilience is something about the people that instead of them not being able to see them face to face, they were able to talk to them on the phone and at least give good, solid health care over the phone like that.
Mhm. Yeah, and so that would mean that you had places for people to get access to those, and then the doctors had access as well.
Yes.
Yeah.
And we have a pharmacy here. We have a lab draw site, a blood draw site here as well. And so what it made us do is have to figure out how do we, with as little access to the entire building as possible, get them in, get the blood drawn, get them out, where not everybody was just mingling together and still had that social distancing and the masking and all of that. And we were able to do that. We had started out with meeting them outside, and we would set their bags of medicine on the car. We'd walk away, they'd come out and get it and take it away. Also, we would have a back door area where our employees come in. We would set that up and have a back area where we were able to set the patients aside from each other and be able to do their blood draws and such there too. Meanwhile, cleaning, making sure everything we did had the patient's best interest as well as ours in mind.
Mhm. So did you see this interfering, the pandemic in particular, interfering with other kinds of health issues aside just from access, but things like there's other there's other vaccinations that need to be, there's the pneumonia vaccine, there's
Yeah,
flu
yeah,
vaccine,
yes,
um, there's uh, the shingles vaccine
yeah.
that you have to get pretty regularly. And so did you see a lot of hesitation around those as well as the COVID, or?
Uh, More so the COVID, but yes, in some of them, they were afraid to take anything at this point in time. Um, that trust
Mhm,
just wasn't there the way it used to be there, and I say that's due to some of the rhetoric that was out in the community and stuff, and how people talked about the vaccines and things, and it made people question altogether. Oh, I didn't think about that. I didn't think about this, you know, not the way that they did with the COVID vaccine and such.
mhm,
The hard part about it was that our patients, they care about it, they worry about it, but then again, they had to decide for themselves whether they wanted to do this or not. And
mhm,
I am so grateful to Lane County for what they did about getting the information out there, by getting what the vaccines out there and such. It allowed us to be able to give our patients a safe place to come in and get those vaccinations.
mhm. Do you see a lot of people taking advantage of things like the shingles vaccine and
No, not at
the
all. Not at all. I I see now where people really want informed inf- information, that they come in and they ask the questions. We're able to have our doctors and providers give them the answer. And then we allow them to make up their own mind. We don't say, you need to do this, you need to do
Mhm,
that, but we give them the information, and it allows them to make their own decision. But it allows them to make an informed decision.
mhm.
Mhm.
How have you seen, there's been a lot of talk about the flu and how it's changed the last couple of years because we're all doing this social distancing thing. Have you seen it change?
Yes. Uh, I think we've really seen less of it. And I do think it's because of the masking up, the hand washing, and sometimes we're just not as diligent as doing these things as we should be.
Mhm,
But with COVID, even myself, I've been less sick over
mhm,
the past 2 years. And a lot of our patients have too, with the flu and such as that. And I think it is because we're doing our due diligence and our universal precautions and such.
mhm. Yeah, I've really enjoyed not. I'm one of those people that gets a cold every season.
Yes, yes,
And it's been so great to not have that. And I need to remind myself that I need to continue to do some of these things.
yes,
Um, uh, uh, but I have to say I've been pretty grateful to not have to wear the mask all the time.
yes, exactly, exactly. I walked into the store and someone was looking at me, and I was like, well, why are they looking at me like that? Well, it was because I had the mask on, and it's because working in a clinic all day,
Mhm,
it's just basically part of the uniform.
mhm,
And so I was just thinking, but it is nice to walk in and be able to breathe.
mhm,
And now, if I see a lot of people around and such, I will keep my mask on.
mhm,
But, you know, the flexibility is great right now.
mhm, mhm. So the FDA just approves um, the second booster for people over 50 with immune issues. Is this something that you think you're gonna see a lot of people taking advantage of at your clinic,
I
or?
do think so. I can't say how I know so, but I do think so, because our population here, we have a lot of older people who can't get state funded health care, and they're going to need that.
Right.
And we have a lot of our patients that have multi-family or multi-generational households. And I think if they're going to want to protect their elders, that way they're protecting the others in the household as well. So I think we will.
Mhm. Do you think the changes in, it's been really interesting to see how you know, most of us don't remember the polio
Right.
movement and things like that. So it's been really interesting to live through this time of, you know, my wife and I were talking about when we were at the fairgrounds and watching all the cars and people getting shots, and what do you think that this slowing down, now that it's not going to be as, you know, big of a push, how do you think that's going to change people's perspective on it?
Mhm. What worries me is that we'll start to downplay it a little bit, and you never know when that next variant's going to come out or mutate into whatever it's going to be. I think from a medical office standpoint, we still need to keep educating people. And so I think what's going to happen is that we're going to have to see more education coming from the offices, the clinics, the doctors' offices, and things like that, to keep people aware of, hey, this is still here, this is still out here. Not that we want to cause a frenzy or anything like that, but still to let them know that you're still susceptible to this.
Right. Right. I think it's been interesting to kind of compare it to when I was doing the research for our exhibit. You know, there was a lot of very similar rhetoric coming out of one of my favorite articles that I have posted is there was a conversation about closing schools. And parents were upset about their kids not being able to go to school because they weren't vaccinated. And this parent specifically asked this doctor, how do we know it's transmissible? How do we know that, you know, and how did the first person get it? And the doctor's response was, I just love it. His response was, I wasn't there. I didn't take care of that case. And
I like that. I like that.
But to a certain extent, it doesn't matter. The first case doesn't matter.
Exactly. Exactly. I love the way you're looking at this, because it's not the first case that matters. It's all of these others. And here's the part for me. I did my research, or so I thought I did my research, but still, in the long run, it was like I didn't hesitate to take a flu shot. Right. I didn't hesitate to take the pneumovax shot. Why am I hesitating now? And so it's my responsibility to protect the community out there. How do I do that? By getting vaccinated myself, because I was more worried about hurting others than I was. I care about myself, don't get me wrong, but still, I didn't want to be walking around as a petri dish, making everybody else sick.
Right. I'm curious if you have had conversations with some of your more resistant clientele and about what their hesitation was. Do you have any ideas what that was?
A lot of them hesitations was, well, I might get it anyway, or I haven't gotten it yet, that type of thing. And then some were just plain scared because some of the population we serve saw it as a way for the government to get information about them. If you know what I mean, that would come back and fall on them to get them removed from this country or whatever.
Right, right.
And it's like, oh, no, 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 no. That's not what it's about. And
Mm,
then it took some of them experiencing death in their family by other members or so to understand I'm not ready to die. I'm not ready to go. I'm ready to get my vaccination.
mhm. Yeah, and there's been a lot of, I know a lot of people who were on Facebook. Do I know anybody who's had it? Do I know anybody, is it really this bad? And it just seems like it shouldn't matter.
Exactly. Exactly.
I I live in one of those mixed households where, we have multiple generations. And so my first thought was is I don't want to be the one that brings it home to my dad,
Yes.
um,
Yes.
who is
Yes.
diabetic, a heart patient, and has COPD.
Mm-hmm. Mm-hmm.
It was just
Yeah.
like, and that's one member of my household. And
Yeah.
I just was very fearful of being the one that brought that home to him.
Yeah.
Um, and currently my mother-in-law is going through chemo
Mm-hmm. Mm-hmm.
and is very immunocompromised. So I have this extra type of vigilance around her.
Sure. Sure.
And
I tell you what, my heart goes out to you because I know it makes you have to be extra cautious as well, and probably extra nervous as
mhm,
well. And my heart goes out to you for that because we don't want to walk around transmitting something that we give to one we love
mhm,
so much, and that's the hard part. And so a lot of people, they get angry because we had a policy for those who were vaccinated and those who weren't
mhm,
vaccinated.
mhm,
Well, they would say, well, the people that's been vaccinating is getting it too, but not at the rate that those that are not vaccinated was getting
mhm.
it.
Yeah.
And so that's where we had to say, no, we have to take care of everybody.
Mhm.
And we did our due diligence. Did it feel good all the time? No, but still, we did what we needed to do to protect each other.
Mhm. I've been one of those people. I did healthcare. I was a nurse's assistant, and so I would get my flu shot when I was doing healthcare.
Yeah,
And then when I left healthcare, I just didn't feel like I needed for myself. I didn't feel like I needed it. And then my dad got the flu a few years ago, and he ended up in the hospital.
yeah, yeah,
And so him and I made a deal where we would both go get the flu shot.
yeah, yeah,
And
exactly.
I have enough medical knowledge to know what the flu shot does and
Mhm.
how it works and why it works the way it does. Um, and it kind of was like, okay, for my dad, I will do this for him.
Yes, yes, yes.
Um,
I love it. I love it.
so is there anything else that you wish the community knew about vaccine access for people who have trouble getting access to healthcare?
You know, when you're going to get your vaccinations, there's other places around town, not just your doctor's offices and things that a lot of people are still hesitant about going into their doctor's
Mhm,
offices and stuff. Our church, we do twice a month. We have access to the COVID vaccination, and they also do flu vaccination
mm,
there as well. And that's a collaboration with Lane County.
mm,
And I like that. And just letting them know that pick up the phone, call your doctor's office, or call Lane County Public Health, ask the question. They have a great hotline there. It's letting them know that yes, we
right.
care, and we will help guide you through this. If you call us at Volunteers in Medicine Clinic, we can
Mhm,
help you, guide you through this. And
mhm,
I just want them to know that there's no judgment here on our part. There's no apostolizing here. And we just want you to have the best information that you can have so you can make the best decision, informed decision that you can.
So what I listened, I was at a presentation you did recently, and you said that you guys focus on adults, correct?
Uh-huh. Uh-huh.
And so if you have children, you refer them to.
No, what we do here at the clinic is that we do the adults and the families, those who are living in the household and they are eligible for the vaccination, we give it to them.
Mhm. But your general practice,
Yeah.
you guys mostly focus on the adults, correct?
On the adults, yes. The adults that over 18 and above is who we focus on, because there's so many out there at the school systems that will help, like the school-based health clinics, and the most of the kids have OHP, and they're able to walk in and get those vaccinations where they're at and such. But that's why we just really focus on the adults. And if we keep them healthy, they usually see to it that the kids are healthy, you know?
Right. I grew up low income, and I think almost all of my vaccinations were done at our local health clinic.
Yeah.
The Lane County Health. It was in Cottage Grove,
Uh-huh.
the little clinic in Cottage Grove. And I do remember, several times going, and I remember I'm not a real big on shots. I have to admit that. And I remember being very hesitant about the polio vaccine, and just because I didn't want another shot. And then it was just a little sugar thing.
Yeah.
I was like, what was I fearing? What was I afraid of? And so it's always good to know what you're getting yourself into.
Amen. Amen.
But so there's lots of resources out there. That's what my point is. And I appreciate this conversation and learning a little bit more about volunteers in medicine. So can you remind our audience where you guys are located?
Sure. We are located at 2260 Marcola Road in Springfield, and we're right across from Springfield Family Practice.
Oh, okay.
And we're there in the shopping center of Albertsons, Joann's Fabrics, Rite Aid. And just give us a call if we can find out whether you're eligible for our clinic or not, because we see patients that fall between 85% to 300% of the federal poverty level. And we would love to take care of you, because the beauty of what Volunteers in Medicine is able to do, we're able, because we don't charge, we don't bill, even for our pharmacy on site or our blood draws, we don't bill the patient anything. And so we're able to morph into what the community needs us to be.
How many doctors do you have?
We have two, co-medical directors, and they are 1 week on, 1 week off. And we have a consistent nurse practitioner that does 16 hours a week here. But we have over 40 volunteer providers, medical doctors, nurse practitioners, physician's assistants that come and volunteer their time to see our patients. So we have capacity here to be seeing more people.
You guys have a fundraiser coming up, correct?
Yes, we do. One Fine Day, and that's our first one that we'll be able to do in public and face-to-face in 2 years. So we're kind of excited about it.
Yes, totally. And people can go to your website and find out more about One Fine Day.
Yes.
Okay.
Yes.
Great. Well, I appreciate your time, DeLeesa. This has been an awesome conversation.
Yes.
And I hope to have you come and see our history of vaccines exhibit here.
You bet. I'd love it.
And also the Eugene Science Center has a set of posters out specifically about MNRA vaccinations. And they're in English and Spanish on the
Okay.
outside of their building.
Okay.
And you can go by, you don't have to pay anything, they're just on the outside.
Okay.
And that talks about how they work and how they're made and things like that. And then Adventure Children's Museum, they put in a little vet clinic, and you can go and give little animals vaccinations and learn all about it there. So we're very thrilled, and
I'd
so,
love to see it.
yeah, these series of presentations is brought to you in part by Lane County Cultural Coalition and Oregon Cultural Trust. So thank you so much, DeLeesa, and I hope to talk to you again soon.
You will. Take
right.
care. Bye-bye.